the non-infectious and degenerative central nervous system diseases in dogs and cats. The diseases are granulomatous meningoencephalitis, necrotizing encephalitis, steroid-responsive meningitis arteritis, polyradiculoneuritis, traumatic brain injury, and hyperthermia. For granulomatous meningoencephalitis, this is an inflammatory central nervous system disease affecting white matter, primarily in dogs. The clinical signs are seizures, vestibular dysfunction, and cervical hyperesthesia. For the diagnosis, in the cerebrospinal fluid, you'll see mononuclear pleocytosis and elevated protein. For imaging, when you do a CT or an MRI, it'll reveal granulomatous lesions. And the treatment is lifelong immunosuppression, for example, prednisolone or cyclosporine. For necrotizing encephalitis, the forms are necrotizing meningoencephalitis and necrotizing leukoencephalitis. Necrotizing meningoencephalitis affects pugs, and necrotizing leukoencephalitis affects Yorkshire Terriers. The clinical signs are forebrain dysfunction, seizures, circling, head pressing, and visual defects. The treatment is glucocorticoids to control inflammation. For steroid-responsive meningitis arteritis, the predisposition is young adult dogs, and the clinical signs are cervical rigidity, hyperesthesia, fever, and anorexia. The central nervous system signs are rare. For the diagnosis, in the cerebrospinal fluid, you'll see neutrophil pleocytosis and elevated IgA and interleukin levels. The treatment is long-term glucocorticoid therapy. For polyradiculoneuritis, also known as Kuhn-Hound paralysis, this is immune-mediated inflammation of the nerve roots. The clinical signs are lower motor neuron paresis, paralysis, and hyperesthesia, and an altered bark. For the prognosis, there can be a spontaneous resolution in 3 to 6 weeks. But if there's respiratory paralysis, it can be fatal. For traumatic brain injury, the types can be primary and secondary. Primary is concussion, contusion, laceration, and hematomas. Secondary traumatic brain injury is from neuronal death due to decreased ATP or increased intracellular calcium, or hypotension or hypoxia. The Cushing's response means that increased intracranial pressure leads to reflex bradycardia and increased blood pressure. For the treatment, you need to manage cerebral edema using hypertonic sodium chloride or mannitol infusions. And for hyperthermia, the causes are environmental heat, excessive activity, seizures, or malignant hyperthermia due to narcotics or muscle relaxants. The clinical signs are tachypnea, seizures, shock, and bloody vomiting or diarrhea. The secondary effects are cerebral edema, multi-organ failure, DIC, and acute kidney injury. For treatment, you need to have rapid cooling measures such as wet towels, fans, and cool IV fluids. For malignant hyperthermia, you need to administer dantrolene, which is a muscle relaxant.